Welcome back to SA Today. It's been a long and grueling 99 days of lockdown since the outbreak of COVID-19 in South Africa. The various interventions by government to save lives and the economy of the country have been better than nothing for some, unlike if things were left to waste. For others, it's been a long and frustrating journey that often ended up in back and forth court battles. Since everyone has been affected by this pandemic, we take this moment to reflect on some issues the country had to put up with since March this year. And Karabo Mashugane is an enterprise development specialist at 2020 Insight. Thank you very much for joining us.
Hi, Colin. Thanks for having me.
What's your impression on how South Africa has handled this national disaster?
I think there's four elements to handling the national disaster. Firstly is obviously dealing with the health impact of the disaster. Secondly is a humanitarian sort of impact on it, with people not being able to work and generate incomes. And then thirdly, linked to both of them, is the economic effect of the avoiding total economic collapse. And then I think the fourth part will be how to deal with economic recovery. So I think on the health part, the initial level 5 and level 4s were really aimed at ensuring that the economy and that the country's health systems are developed to be able to cope with this pandemic. And I think the announcement was that we've got about 36,000 beds or so that can cope with people that need to be hospitalized. So I think we've done a reasonably good job. Obviously, more needs to be done, because critically that affects the mortality rate that we have with the pandemic. So the more health facilities we have, the more we can assist people that get infected. I think the lower the number of people we will have who pass away from this thing. And I think government has done a reasonably good job there. In terms of the humanitarian support, I think through things like the Solidarity Fund, etc., we've seen quite a lot of effort being taken to ensure that people don't go hungry, that people do still have, I think they get support, those who need it. And I think there again, there's obviously been mishaps, etc., but I think a reasonably good job has also been done there. The economic effect, we've seen a lot of funding coming through for small businesses. Obviously, the recent funding also that has come through from the new development bank, as well as just government's 500 billion sort of stimulus package coming in there. So I think some reasonable jobs have been done. And what we were looking at was for the minister through the supplementary budget to then give us some roadmap as to how do we actually now recover in this new normal, as people say.
Yeah, but then, obviously the lockdown was a blow to some businesses and jobs, and it wasn't easy to please everyone. That's why we had these back and forth court appearances by government and the litigants. So then the issue here is economic recovery. Should we chase that, given that we are approaching peak season, or should one appreciate the little that they have?
I think everything is really interlinked. I think firstly, the economic recovery and how we deal with it is really based on how we deal with the virus. If the impact of this virus gets out of hand and we cannot manage that, then there's no point really speaking about economic recovery. There's been a lot of sort of commentators that have compared the effect of the virus to sort of a country in wartime. And in terms of, if you're in war, if you don't win the war, if the war doesn't come to an end, it's really pointless talking about economic recovery. So the first thing I think is we must ensure, and as part of even the economic recovery plan, must be to deal with some of the medium-term impacts of this virus and dealing with it. And I think we've seen the minister announcing, for example, 100 billion rand infrastructure development budget over the next 10 years. Things like that, I think we need to ensure that a big part of that budget is geared, for example, towards ensuring that we're developing the health infrastructure, which has always been lagging in this country. So I think that the two things are linked, and we can't separate them.
So when it comes to what one would either call a balancing act or juggling around of the status quo, is the concern regarding occupational health and safety standards. I mean, people have gone back to work, But infections are rising and children have to go back to school, and also the infections are then detected. So at this rate, what really must happen? Because the concern of whether to stop or to slow down is neither here nor there, because the peak season is already upon us.
Yeah, so I remember initially when this virus started, Minister of Health mentioned that we will probably see about 60 to 70% of our population getting infected with this virus. So I think it's always just been a case of the speed at which we get infected and our ability through the health system and the economy to cope with it. So I think the increase in the infection rate has been almost built in, and it's to be expected. The critical thing is, what do you do and what do you have when those infections increase? I think a lot of people have adjusted their behavior, and as the infection rates increases and even the mortality rate increases, we will see more and more people adopting the safer behavior. I think the critical thing there is the infrastructure that we develop, supporting our health system to deal with the effect of that, and then also enabling business and schools, etc., to operate even in an environment where we have high infection rates. And a big part of that is really just the IT infrastructure in the country. When we talk about infrastructure, generally you're talking about firstly the human resource element of whether it's an economy or a business. You're talking about the physical equipment and tools and equipment that you have there, and buildings, etc. And then you're talking about the technology. I think in the country a lot has been done to try and develop skills, but we need to ensure that a big part of the skills we're developing is technological skills, and also we need to focus a lot on developing our technological capabilities. And those will really help to drive increased productivity in the country, which will help support economic recovery. I think without increasing our productivity, what will happen is that all these funds that are being put into the economy are just going to be seeped through, are just going to disappear through imports. So what we need to do is ensure that our internal productivity is high, and that the development that we're doing, infrastructure for an economy 100 years ago and infrastructure today are totally different things. South Africa has a reasonably well-developed physical infrastructure, but our technology, I think we need to do a whole lot more there, because we've had an economy really that's quite sophisticated, that focuses a lot on services and financial services, etc., that's driven by that. So we need to focus on those things that we're doing well, and ensure that a big part of our infrastructural spend is focused on that, on developing technology and on developing our technological sort of capabilities as people. So that touches, for me, I would look at the health system and the education system together to ensure that we're developing those technologies in those two things, which will help us cope with the virus itself, but also ensure that we're developing through education and through skills development our ability to grow the economy post this thing, or even while it lasts, if it's going to last for a long time.
When it comes to small business recovery, we've got sectors that will blow hot and cold at the same time. For example, if you look at the restaurant business, they have to open for food, but one owner was saying that he can't even call his waiters back to come to work, because if people are going to sit down and eat, after that they have to leave. They're not going to stay longer because they can't purchase alcohol, and they're making 70% of their profit from alcoholic beverages. So what do you do then when it comes to speaking the notion of business recovery, when you can't do the actual act of recovery itself?
Yeah, so a lot of businesses, unfortunately, are going to have to be almost repurposed, because the reality is that in the short to medium term, which is probably over the next year to the next 2 years, some of these businesses are not going to be viable with their old business models. So, you speak about obviously the restaurants not being able to sell alcohol and people not staying for long, but also social distancing requires that you can't crowd your restaurant as much as you used to. So it hits you on a lot of sides, and I think what is key for some businesses is accept this as a new normal and try and figure out a way of functioning even in this. And also, a lot of the negotiation with regards to the costs. So if you can't get your waiters to come back to work, a little bit of revenue is better than nothing. Same thing with landlords, etc. I think the key thing is to negotiate with the people that support you with the input costs, with the people that provide you with infrastructure, to try and lower your costs, because obviously your revenue is going to be less. And then see with what you have, what else can you do with regards to restaurants, maybe focusing more on caterings and deliveries, etc., and things like that. But I think we need to accept that for a lot of businesses, you will not return to the revenues, to the turnovers that you are used to. So how do you lower your costs, and how do you repurpose some of the skills and capabilities that you have to serve some of the emerging needs that are coming through as people's behaviors change, etc.
All right. Karabo Mashugane is Enterprise Development Specialist from 2020 Insight. Thank you very much for making time to speak to us as we recount the 99 days of the national lockdown. We're going to take a break, and I'll see you